So atrial myopathy can be diagnosed using heart imaging tests. And the two most common ones would be a heart ultrasound, or commonly known as an echocardiogram, and also an MRI study that's dedicated for the heart. So that's known as a cardiac MRI. These two imaging tests enable us to assess the function of the left atrium and hence diagnose atrial myopathy. Additionally, we can also use the standard electrocardiogram or the ECG because there are certain parameters or certain features, namely the P wave, if they're abnormal, that can give us an indication that there's atrial myopathy. Some blood test markers, like BNP, if they're elevated, that can also indicate atrial myopathy. Now, regarding the second question, in people with atrial fibrillation, how can we diagnose underlying atrial myopathy? It would be the same test as well. So if somebody has atrial fibrillation, very commonly they get an echocardiogram done. And from the echocardiographic images, we will be able to ascertain or diagnose the atrial myopathy based on the left atrial function. And what to assess the risk of dementia. So as I explained in the paper that I showed during the presentation, if people have lower left atrial function below a certain cutoff, in that paper we had a cutoff of 27%. If the strain is less than 27%, then there can be an elevated risk of dementia.